Hi, I'm Dr. Elaine DISPO-RENDON, the founder of ANAK KO 501c3 nonprofit public charity for grievers. Now, many of us grieve the losses of loved ones, but we also may even grieve for our own health. Have you encountered a change in your health, like pregnancy, giving birth, a debilitating injury, a serious diagnosis, or supporting a loved one with health issues? All of those can bring on forms of stress and grief. Today I'm going to share with you the story about my health journey and what has helped me as well as others cope with changes in their physical health in order to take care of their mental health. For me, I'm in my middle ages now, and so the changes like hair going gray, skin going wrinkly, can have their share of stress as well. But mine has to do more with other physical health issues. I've had heart palpitations for over half my life. I experienced 2 pregnancy losses and actually started ANAK KO to honor my babies as well as my pets who I've lost, and also the ones I still have here at home with me. And also the most major health issue that I've been going through for most of my life has been my gastroenterological issues. I've always had GERD and heartburn for most of my adulthood, but it got even more severe to the point where I started getting tested and treatment and got diagnosed with quite a few GI issues, which I'll name off some of them, including fatty liver disease that was non-alcoholic, Barrett's esophagus, which is esophageal metaplasia. There are changes in the esophageal tissue that may be similar to intestinal tissue, and it increases the risk of esophageal cancer. I also have intestinal metaplasia meaning changes in the tissue as well, which increases my risk of stomach cancer. And I also have achalasia, which is the paralysis of the esophageal muscles, making it hard for me to swallow, and gastroparesis, which is the paralysis of the stomach muscles to induce the delay of gastric emptying. And I actually got diagnosed with gastroparesis as a result of damage to the vagus nerve during my stomach surgery to repair my hiatal hernia, which means that my stomach may be going up through the tube of the esophagus, causing the stomach acids to rise. So I had what was called a partial fundoplication to wrap some of my stomach around my esophagus. And while I still have that mesh intact, unfortunately my hiatal hernia came back. So I'm mainly managing my hiatal hernia again, and my I was going to say Barrett's esophagus, but that got corrected supposedly during my stomach surgery. But I'm also managing gastroparesis, which is a chronic disease that I will have to deal with for the rest of my life. And all of these diagnoses in the past few years have warranted continued medical surveillance that I'll have to always undergo for screening and just seeing if any cancer is progressing, or trying to slow the progress through treatments, including medications and dietary adjustments, which has been quite the undertaking because my eating habits had to change, and I've gone through different weight gain and different weight loss journeys in the process, not just through my gastro issues, but even as a result of my pregnancy losses. I continued to gain weight, eating like I was eating for two, because I was going through postpartum depression without actually having given birth to a live baby. So it was just, to be honest, a hot mess. And I am just trying to deal with it, but I have my good days and my bad days, both with my physical health and with my mental health. Just sometimes days where I'm just happy to have bowel movement, TMI, too much information, TBH, to be honest with you, but it's part of my normal now to want to have BMs, because I don't always have them on the regular anymore. So finding something to eat and ways of managing stress and the different factors that come into play with being able to have somewhat normal functioning helps me feel better. But when I have a flare-up or I don't have BM for a day, I do honestly get discouraged, or other issues may come up that may affect my GI system. So it's just it's a struggle, and it's real. But like my spiritual mentor, who is a ANAK ko Obispo, Bishop Mike, would tell me, take it one day at a time with the Lord. And if we have a belief system, that definitely helps. And for me, prayer has definitely been the center of my life, and seeking intercessions from saints, including Saint Francis of Assisi for animals, Saint Jude Thaddeus, the patron saint of helpless causes, and Saint Padre Pio, who says, pray, hope, and don't worry. I'm looking at the banner that's hanging up in front of me in my living room, and that my mom gave me. And these are good reminders, and we'll go through other ways that can help you that have also helped me. Mainly support systems of positive people and pets are very helpful. Not having toxic communication, not sometimes even detoxing from social media, because consuming a lot of it can get to be too much. We might compare ourselves, going through the social comparison of what people are going through that may be better or worse than our own situations, when we all have our unique stories to share and to go through. Also, having a journal, both to count our blessings of gratitude, but also to vent. And it helps to have the support system to vent as well. So if we have a channel to write or to talk about our feelings and what we're going through, because even though I have my own set of health problems, you may have your own unique stressors as well, but we may have similar feelings about our issues, whether we're angry or we're upset. And unfortunately, not all of it is within our control. We can do our best to manage symptoms and health and other circumstances, but we can't control everything. And what we can control is how we deal with anything that comes our way. Now, I want to read what my good friend Amy texted me last night, because we've been exchanging stories about our own health journeys, and I've known her for over half my life, since our early 20s. So she said to me, chronic health problems definitely takes its toll, but no, you are not alone. Sometimes it's hard to give up parts of ourselves that we're so deeply rooted in our identity, but we will grow and adapt to those challenges, not because we have to, but because we're resilient. We will find new aspects of ourselves we may have not had the chance to uncover if not given these particular challenges. So keeping that into perspective, we must know that we're not the only ones who have these problems, and we can have outlets to reach, whether it be our journal or somebody who we trust and can give us positive enlightenment, or just somebody who is there to listen. And also coping with it ourselves, just living our best lives, not being defined by the problems that we have or the health issues that we are diagnosed with or our struggles, but the way that we are adapting to and overcoming them, because this may be our reality. We may not be able to fully escape the harsh issues that we're going through, but we can at least take care of ourselves in the process and just give ourselves nourishment in whatever ways that are healthy and beneficial to us. For example, I have so many dietary restrictions. It's not even funny. I cannot drink alcohol or consume caffeine or chocolate or spicy or fried foods. Anything that's really acidic and has a low pH level and isn't alkaline is going to do damage. But on the other hand, with my gastroparesis, I've had to expand my menu again with less fiber, more protein, in order to help my gastric emptying. But I admittedly have reached some of my vices, like chocolate or coffee that's caffeinated occasionally, and of course that's not really the solution when I'm stressed out. I can reach for something else, and not necessarily reach out for food for comfort, but maybe some low impact exercise now that my hernia has prevented me from doing high intensity. Now, my primary care physician, Dr. Landero, who is the top ANAK KO donor, has actually prescribed me tennis for muscle memory, but it does call for a lot of running, which I no longer can do. And that's one thing that I was grieving about, honestly, is that I'm restricted in my diet and I'm a foodie, so that's just hard to digest figuratively and literally. But also I used to lead a very active lifestyle, and not being able to exercise the way I wanted to does hurt quite a bit. But at the same time, I can find different alternatives, like what Amy told me in her quote, in her text that I'm quoting to you today, that she told me yesterday. And my mom has also been very supportive and texting me prayers and inspirational quotes. So it really does have help to have somebody in our corner. And she's also a great supporter of ANAK KO as well, which also helps our cause for grievers. And my husband, Chef David, the co-founder of ANAK KO, also has been giving me pep talks as well. So it really helps to have support system and self-care for any type of stress that we're going through, including grief and including the stresses that we encounter as a result of our physical health, in order to mend our mental health. Thank you for tuning in, and stay blessed. Thank you.